Hi guys, welcome to our channel. This is Diabetesdocke_KE, where we talk all things diabetes. So today I have a very special guest with us, and her name is Stella. She will introduce herself. She has come to ask me questions from the diabetes community. So Stella.
Yes, Doc.
Karibu sana. Introduce yourself.
Thank you so much. My name is Stella from Young and Sweets. I'm also a clinical nutritionist. Thank you for hosting me today. I'll have some questions for you from the big team.
Shoot them.
Thank you so much. Number one, I'm asking about fasting. The normal fasting for a Christian, for a Muslim, or any religion. Is it possible? How do you take it? Am I supposed to fast? Which are the most factors I'm supposed to observe? Kindly.
Okay, so can someone with diabetes fast? The
Yes.
answer is yes, but not all.
Okay.
So there is something we call risk stratification, which means for every person with diabetes, there's a certain risk they have that they can get into complications if they fast. And our biggest complication is hypoglycemia, low blood sugar, because as you know, that can kill. So whenever you want to fast, talk to your doctor, because there's a way we will look at you and see whether you are low risk, medium risk, or high risk.
Okay.
If you are high risk, we do not recommend that you fast. Whether you're Muslim, Christian, it doesn't matter. Do not fast. Low risk means yes, you can fast as long as we supervise you well. And then medium risk means you should not fast, but if it is very close to your heart, then go ahead, but make sure that you communicate with your doctor on a very close level. I hope I've answered your question.
How often should I ask a doctor, or should I visit a doctor before I do my fasting?
So for people who are Muslim, we usually recommend that within the previous 3 months before fasting, they need to have an intensive follow-up, especially those with moderate risk, so that by the time that Ramadan is starting, the doctor can clear them for the fasting under close monitoring. For Christians who want to do the fasting, usually it's not a whole month. Usually it's just a few days. I would recommend that at least 1 month to 2 weeks before the fasting, that they go and talk to their doctor.
Okay.
Yes.
Thank you. You have answered my question. Number two, it's about stress. Either type 1, either type 2. We usually have normal stress. There are daily life stresses, the stress about the condition, family issues. But again, we are having a lot of questions from the group when I'm having stress. Kila wakati nimeenda shule, nimepatwa mwalimu amenisumbua because of school fees, there's exam, ama shosho amekuja, mtoto anamsumbua, akikuja hospitali, the sugars are high. What is the relationship between stress and the sugars?
So there are many things I can see there. One is the person. So when someone is stressed, anybody who is stressed, it is much harder to start monitoring your sugars the way you would when you're not stressed, because sometimes depression sets in. Now, we see a lot of people who want to miss their doses when they're stressed.
Sure.
And so that's one of the contributing factors. Kwamba madawa hazifuatiliwi the way they should. Then the second thing is now regarding the way the body is reacting to the stress. So there are things called stress hormones. One of them is something called cortisol. You see the way if you see a snake right now, you're going to run. The body knows that, and so it releases something called stress hormones, which include epinephrine, norepinephrine, glucagon. So they ensure that you have enough sugar to run from whatever is causing you harm. So when you have so much stress, the body also thinks that you're in harm and releases a lot of stress hormones. Those stress hormones increase your sugar.
Okay.
Yeah. So glucagon, epinephrine, all those make your sugar go up. So that means also your body itself can just increase your sugar levels. Then another way that I can see it happening is many people cope with stress through food. So you will find that it's not really the problem is that the body or the insulin. It's just because you eat more when you're stressed. And because you eat more, the sugar goes high. Yes.
Okay. About stress, there are some medication, some people complaining, nikienda hospitali napatiwa dawa because of stress. Maybe for sleeping, the sleeping pills, maybe nimeambiwa niko na depression, nimepatiwa dawa, but now after taking the medicines, sugars zinaanza kuwa high. They are not mentioning ni kukula sana na kula sana, lakini the issue anasema ni medication ya stress, medication ya depression. is there any relationship
with that?
Yes.
Now that's a good question, because there are some dawas ambazo zinapeanwa kwa people who have like depression and psychosis ambazo zinapandisha sukari. Kama kuna dawa inaitwa olanzapine na zingine kwa hiyo class ambazo actually they can even cause diabetes. So wakati tunaona mtu akona hiyo dawa na akona diabetes, tunatoa hiyo dawa, tunabadilisha. So there is some truth there kwamba yes, wanaweza kuwa na hizi shida zingine, wanakula, wanafanya nini, lakini pia dawa yenyewe can cause diabetes.
Okay.
Yes.
Guys, I hope munasikia your answers from the questions. Hata kama you are not feeling the kizungu, make sure you get one thing, at least umeshika kitu moja.
For pombe, it's important kujua ni pombe gani unakunywa. So msikunywe pombe zenye ziko na sukari mingi. Kuna kina Baileys, akina sweet red wine, akina sweet white wine, hata hizi ma alcohol hizi zinaitwaje hizi mabia. Bia unajua iko na hizi bali ina breakiwa down into sugar. So avoid that. Kama unataka kukunywa, na kumbuka the units ni 1 unit for a lady na 2 units for a man maximum. So hiyo kunywa just the dry things. Unaona hizo makali shot 2 hiyo inatosha.
Guys,
for a man
shot
moja for a woman bas.
Okay. Red wine.
Yes.
Naambiwa nikunywe red wine ndio mzuri, na sugars nisitumie hizi zingine.
Red wine sweet ama dry?
Zote tu. Inaweza kuwa ni sweet, inaweza kuwa ni dry.
Okay, unajua hiyo kitu ya red wine ilitokana from ile tunaitanga Mediterranean diet. Wale wasenyo wanaishi Greece, hizo areas, every time wakikula wanakunywa red wine with every meal. Na ilionekana kwamba actually their rate of heart disease is lower, their rate of complications just generally is lower. So because of that, there's some things that are produced from red wine in particular, not even white wine. There are some products ambazo stazisema jio jina ni ngumu.
Sweet ama the white?
Sweet red, hata white red, hata dry red.
Okay.
Hizo products zinasaidia sana ku reduce inflammation in the blood vessels. Yeah. So if someone takes 1 glass for a lady or 2 glasses for a man in a day, it is thought that inaweza saidia mwili in general.
Okay.
Hata Bible ilisema a little wine.
Tusilete Bible hapa. Anyway, the last question for today, how long am I supposed to stay with my insulin? Like nimepatiwa leo, naweza itumia next year. Unajua naweza sema sitaki kujidunga. Hii kujidunga wacha kwanza ni rest maybe for some 4 months, alafu naweza itumia. Kwa sababu saa with how the economy is, naweza opt to si lazima nitumie dawa. Naweza save juu next month sitakuwa na pesa. Is it okay for me to use it after 2 months, after a year?
Sasa unajua ina depend. Kwanza expiry date lazima muangalie. Like any drug out there, insulin lazima muangalie the expiry date imeandikwa ni lini. Then after that ujue umeifungua, because ukishafungua insulin by the way umesharudisha hiyo shelf life, imekuwa very short. So lazima uitumie within like a month, maximum 1.5 months from the opening. So kama iko haijafunguliwa, whether it is a pen or a vial, angalia to the expiry. Kama expiry pengine imesema 2024 December, unaweza kaa tu nayo hadi hiyo time, bora umeistore vizuri, make sure iko in the right temperature. Lakini kama si the right temperature, inaweza haribu.
Okay.
Yeah. Wanasema
any other question for today?
Ni wewe ndio uko na question.
Unajua unaweza kuwa na swali kwangu. For me I'm done, lakini unaweza kuwa you have questions.
Mimi naona hizo swali zenu ni poa sana.
Ziko poa.
Waambie wa keep it coming, kama kuna zingine nitazijibu.
Sawa. Thank you so much.
Welcome.
Thank you.
Yeah. Guys, I hope you've learned from the rapid fire questions. Bye.